Recent research has reported on how the COVID-19 pandemic has increased sedentary behaviors, particularly prolonged sitting. To talk about his recent research on prolonged sitting and cardiovascular health, we have with us today Gustavo Oliveira da Silva. He's a researcher at the Universidade 9 de Julio in Sao Paulo. Also joining me and asking questions today is Matt Lees from the University of Toronto. Gustavo, is it fair to say that we are sitting more than ever and that there are consequences to our health?
We have some technological advancements that are leading us to spend more time in a sitting position, things that we usually could do in a more active way, we're able to do now on the computer, on the phone. We have a lot of these advancements. We don't have to go to the bank anymore to solve a problem or anything like that. So this technological advancements are leading us to sit even more. And we already know that there are consequences of prolonged sitting to our cardiovascular health.
Hi, Gustavo. I was wondering about your opinion on active working and measures like standing desks and those interventions that are trying to improve those aspects. So would these be appropriate in your view to get some of the beneficial effects of exercise, or is that more of a structured program necessary?
Well, I think these are effective measures, but I don't think they're the only ones that we can use or the only ones that we should use. We know that treadmill workstations are effective. We know that sit-stand desks are effective, but they're not the only options. And also we know that we cannot spend too much time sitting. We cannot also spend too much time standing. But I think there are other measures that we can use. A more structured program is necessary because we know that when we're in an office setting, we need organizational measures, we need environmental measures, we also need individual measures. So we cannot just use one of them and forget about the others. You can just put a treadmill workstation in the middle of the office and expect everyone to use it when they don't even know what that's for. So we also need these other measures that we can even talk about.
Thanks. One of the major outcomes or measures in your systematic review was flow-mediated dilation. And for folks that might not be aware, can you briefly explain what that is and the significance of that measure within the context of your review? And what are the consequences of improving that metric?
The flow-mediated dilation is an indicator of vascular function. In this measure, briefly, we use a blood pressure cuff to cause an occlusion to the artery. And then we measure the artery diameter before and after this occlusion. And then we basically see how much the artery dilated after the occlusion in comparison to before the occlusion. And that's an indication of the vascular function for other situations, such as exercise or when we're walking. It's basically, we try to simulate what happens when you have a demand of blood to an area that wasn't being exercised before, that wasn't being literally used before. So that's an indication of vascular function. And we know the studies that show that prolonged sitting leads to impairments in vascular function. So if you spend too much time sitting, your vascular function will decline, and that can lead to vascular problems that in turn eventually will lead to vascular diseases and vascular consequences. So the idea of the sitting breaks is also to try to prevent these deleterious effects of sitting on vascular function.
And with the pandemic has induced a shift, I guess, towards remote working and work from home regimes globally. So how would you see sitting breaks being incorporated within this new world that we have?
Well, we know that a lot of us had to go home to work from home and do our stuff from home as we're doing right now. So I believe that from what I mentioned before, the individual measures are a type of measure that can be effectively incorporated into the home office setting, because we already know of computer programs that can be used to remind us to break up sitting from now and again. Smartphone apps can also be used. Some studies have used text messages reminders to break up seating. So I think that these measures are they're the ones that are most easily applied in the home office.
Yeah, you've sort of answered my last question, really. It was going to be around, in your opinion, what are the best motivational strategies or prompts that might help someone remember to perform a sitting break?
Yeah,
And
but
how
if
might that be integrated?
yeah, but if I could also complement the answer, it's also like you cannot just use the individual measures when you're in the home office, because you also need the educational part. You need to tell people that why they should break up seating, why it is important to break up seating, what are the consequences of prolonged seating in their cardiovascular health and their health in general. And I think that is necessary even before you use the computer programs, the smartphone apps, because they need to know what they're doing, what is important to do it. And sometimes if you can effectively do that, you just literally need just to remind them to break up seating, because we're sometimes so caught up in our computer work, in our work from home, that we just forget to break up seating. So the studies that have used these computer programs to do it, they just use reminders. So you're there using your computer every 15 to 30 minutes or 60 minutes, you receive a reminder. You already know the importance of breakup seating. So I think that it's part of the whole success of the intervention.
And just off the top of my head, is there any difference between working in a group setting or individually, i.e. at home versus in the office environment with other people? Does that have an impact on like adherence to sitting breaks?
We don't know exactly the exact effect of that, but the studies that have used these multi-component interventions, they always use in the organizational aspect. They set up what they call a team champion or a team leader, that he's kind of responsible to remind the others to also break up seating. So I think, at least no matter of opinion, I think that when you do that in a group, you not also remind yourself to break up seating, but you can also remind other people. You can also motivate other people. I would indeed recommend to do it together. It's sometimes you can motivate you literally motivate your neighbor to break up seating.
Gustavo, many thanks for taking the time today and for answering all our questions. Good luck with your further research.
Sure. Thank you.